Welcome, and please proceed.
Thank you, Mr. Chairman, members of the committee. House Bill 5353, the Patient Safety Act, would put limits on the number of patients that nurses can care for at one time. I think we all can understand that when nurses are pushed beyond their limits, that patient safety and care suffers, and that this legislation is based on similar bills in California and Massachusetts. And during the course of this hearing, you will hear a testimony from nurses that will describe more the day-to-day, the way that this would impact their lives, and they believe, and I believe, provide better care for our patients. Thank you, Mr. Chairman.
And what I want to do here is to just say, to put you in my shoes for an 8-hour day and give you an example of what has recently happened on a med-surg floor that we find deplorable. And we find it unsafe for the patient as well as the professionals taking care of those patients. When you have a surgical unit that consists of all types of surgeries, which includes abdominal, chest surgeries, orthopedic surgeries, isolation patients, anything like that, ill patients, that's why they're there, they're in the hospital. Patients that are on the floors were not patients that were on the floors 10 years ago or even 8 years ago. Those people were in ICU and people were dying. The acuity has changed. So when they say that they want the flexibility because of the acuity, I want to know who they're asking for that acuity. Because they keep saying the bedside nurse, we don't get asked. What we get is told. And when we fill out unsafe staffing reports, this is just from January, okay? When a nurse feels that unsafe, and we have forms that they have to fill out that they don't have to be accountable for to the state that says what our staffing should be, that kind of ticks us off. And the reason it does is because it's us taking care of those patients. We can't give the quality because we do have too much quantity.
That's 2 minutes.
Okay, thank you.
Please.
Hi, I'm Helene Macedo, and I'm a registered nurse in the, that's okay, in the operating room at Rhode Island Hospital, and I'm also the president of our union here. And I want to say this is, again, examples of unsafe staffing forms that are filled out at Rhode Island Hospital. We're a level 1 trauma center. We know what it takes to take care of our patients. And when we come in to a situation and we see what the acuity of our patients, what the acuity is, and we bring that concern forward in our professional opinion as a registered nurse, and we are told that you have to do what you can do, that's not acceptable. It's not acceptable to, for example, be a patient who's coming into the emergency room at Rhode Island Hospital. You have abdominal pain, your leg is mangled, you get put into a trauma room. The nurse that's in that trauma room has another patient that's just as ill as you are. And now they're trying to address your needs. She looks up, the monitor's going off, that patient's blood pressure is dropping. So instead of being able to attend to you, she's now over there. The doctor's coming back in, yelling that you need to go to CAT scan. She hasn't even medicated you, been able to take vital signs. She's tried to call for her clinical manager to come in and help, her assistant clinical manager. Pages either go unanswered or they're busy, and it's just do what you can do. That's not acceptable. We are not asking for numbers that are unreasonable. And this happens in the emergency room, in our ICUs, where they pretty much will have the ratio as one nurse to 2 patients, and they can't manage when there are patients that most patients need one-to-one attention, and now you can't. So some patient is not being taken care of. And that is not what we do as nurses and what we ever went into this profession to do, to not be able to take care of our patients that are there.
That's
Thank you.
Perfect.